A 37-year-old engineer, let's call her Angelica, suffered from insomnia. Every night, between 1 and 3 a.m., she woke up feeling restless and angry. She described feeling like a caged tiger. She was unable to lie still, compulsively squeezing her hands into tight fists, kicking out with her legs, and clenching her jaw. Sometimes these episodes would last several hours, and she could never get back to sleep afterwards. Angelica had just gotten promoted to a management role at her firm. This had come with a pay bump that enabled her to buy her dream house. "I'm at such a great point in my life," she told me, "and I feel like I'm ready to find someone I can share it with. I'd like to get out there and date, but if I bring someone home and then wake up like this, they'll think I'm a raving lunatic." Her PCP had referred her to a sleep specialist who had diagnosed her with sleep apnea and prescribed the use of a CPAP mask. But she kept waking up the same as before, having wrenched the mask off her face in her fitful sleep. I noticed that Angelica had a pronounced forward head posture, with hunched, rounded shoulders. I saw that every time she breathed, her chest puffed out and her shoulders rose toward her ears. When I asked, she said she often had pain in her upper shoulders and neck, and frequent migraines with nausea and vertigo. She also suffered from menstrual cramps so severe that she often had to call out of work when they came. As the only woman on her team, she often felt judged for this, which further added to her already very high stress level. When I felt Angelica's pulse at the wrist, I noted that it felt as though someone was plucking the string of a bow or a guitar. This is what we call a wiry or bowstring pulse in Chinese medicine. Her tongue had red edges and a red tip. With her permission, I felt her abdomen and noted that the area just under her ribcage was extremely tight. Angelica flinched strongly with even a very light touch in this area. All of these signs and symptoms denote a very high level of muscle tension and vasoconstriction throughout the body. Angelica's problem was a dysregulation of her sympathetic nervous system, what most people know as the fight or flight response. When this system is healthy, it kicks on for short burst periods when it's needed to protect you from a threat. However, sometimes, when a very high level of stress is sustained over a long period of time, the system becomes sort of stuck in activation. I could tell this was the case with Angelica by her description of her episodes. Her urge to kick out with her legs and clench her fists and jaw were signs of her body trying to deal with a threat. When the fight-or-flight system malfunctions in this way, the body behaves like it's fighting or fleeing all the time, even when it's meant to be asleep. Like your neighbor's car alarm that keeps going off in the middle of the night, it can be triggered by just about anything, and often by what seems like nothing at all. The tight muscles in Angelica's neck, chest, and abdomen were preventing her from breathing properly. This was contributing to her sleep apnea, which in turn was helping to trigger her untimely fight-or-flight response. The sleep deprivation resulting from this was making her even more on edge and stressed, which then put her fight-or-flight system even more on high alert. I knew that breaking this vicious cycle had to be my first priority. I started with massage therapy, using Western myofascial release and stretching techniques combined with traditional East Asian medical massage and cupping to release the tight muscles in her neck, shoulders, chest, and abdomen. This allowed Angelica's chest to open, her head to lift, and her shoulders to relax and descend. I could already see the change in her posture and breathing, but I knew this was only the tip of the iceberg. To get to the root of her problem, I would need to fix the hypersensitive car alarm that was waking her in the first place. This would require me to affect the body at a deeper and more subtle level than my hands could reach. This is where acupuncture comes in. The insertion of hair-thin acupuncture needles at precisely chosen access points on the surface of the body allows me to get leverage on the fascial network, the web of connective tissue that links the whole body, from the surface of the skin to the deepest internal organs. If you'd like to learn more about how acupuncture works, you can check out the video I made about it, creatively entitled How Acupuncture Works. I carefully selected a set of points for Angelica that have well-documented effects on the fight-or-flight response. Initially, she was nervous about the needles and squeezed her eyes shut so she would not have to look. After a few minutes, she asked, "So are you going to put them in or what?" and was pleasantly surprised when I informed her that I already had. From there, I had her pick out some music to listen to and let her relax on my nice soft treatment table under the infrared heat lamps for about 15 minutes while I wrote up my notes in the next room. After a little while, I was gratified to hear her gently snoring. That night, Angelica had her first full night's sleep in over a month. I followed up with her twice a week for the next 3 weeks. By the end of this course of treatment, her sleep had returned to normal, her menses had become much less painful, and her migraines had resolved entirely. She'd even gone on a promising first date. If you feel you or someone you know could benefit from this unique, comprehensive approach to care, please visit my website at silkroadhealthllc.com to schedule a consultation.